I am Dr. H.T Wickremesinghe, Senior Consultant Pediatrician from Sri Lanka. Micronutrient requirement during COVID-19 pandemic in children. It is true that proper nutrition and adequate consumption of fruits and vegetables would be sufficient for any individual to have his required micronutrients, and there is a balanced nutrition is vital for children's growth, development, and immunity. Micronutrients especially play a vital role in building up immunity, providing necessary ingredients to fight against many infections and to prevent the growth of cancer cells. Vitamins like C, D, A, E, and folic acid, and minerals such as zinc, iron, selenium are notably known to boost immunity. Influence of modern Western diet on urban children in Sri Lanka has changed the traditional plant-based diet to a high-protein, high-fat, and high-sugar diet with very little consumption of fruits and vegetables. This resulted in escalating obesity and metabolic syndrome in urban children. What was not surfaced out is the widespread subclinical deficiencies of micronutrients in children as a result of imbalanced diet. In general, there's a transition from outdoor inadequate exposure, outdoor activities. In general, though we have ample sunlight, our exposure to sunlight has significantly reduced, making us vitamin D deficient. In summary, reduced outdoor activities, dietary changes over the last century has made Sri Lankans more vulnerable to excessive energy imbalance, leading to obesity together with micronutrient deficiencies. Deficiencies of micronutrients may change the outcome of COVID-19 infections in children and adults during this pandemic. But routine use of vitamins will not help to prevent COVID infections. The only possible benefit of using vitamins and micronutrients during the pandemic is that it may help to correct any vitamin deficiencies already existing. During the COVID-19 pandemic, prolonged closure of schools, keeping children at home, and lack of outdoor activities may deprive them with exposure to sunlight, making them more prone to develop vitamin D deficiency. Vitamin D deficiency is known to adversely affect the outcome of COVID-19 infection. Studies have shown that vitamin D deficiency is associated with increased severity and mortality in COVID-19 patients. There are many studies to show that the treatment with 25-hydroxycholecalciferol, a metabolite of vitamin D during COVID-19 infection, reduces the severity and the mortality due to COVID-19. Many European countries add 25-hydroxycholecalciferol to the treatment regime of COVID-19 infection. Similarly, zinc is also known to help in preventing the entry of the virus into the cells. Therefore, it is very important to maintain adequate vitamin D levels during the pandemic. In the same note, maintaining optimum requirement of vitamins and minerals which are known to boost the general immunity is a priority during this pandemic. Deficiency of each micronutrient has a specific signs and symptoms that helps the clinician to diagnose and identify the exact deficient micronutrient. However, the children with micronutrient deficiencies do have some non-specific signs and symptoms such as lethargy, tiredness, fatigue, irritability, loss of poor appetite, an increase in susceptibility of infections, and poor wound healing and prolonged recovery time from infections. If a child experiencing any of the above signs and symptoms, it may indicate a deficiency of essential micronutrient and suggest a need to consult a pediatrician. Though the properly balanced and adequate diet is always the first and the best choice to meet the nutritional requirement of children in challenging situations where feeding of the child with sufficient fruits and vegetables is in question, or the restrictions due to the ongoing pandemic, nutritional supplementation and multivitamins may help to ensure that the child gets his or her daily requirement of micronutrients. In summary, it is very important to ensure that the child receives optimal requirement of all essential vitamins and minerals, especially through diet or supplementation, and to make sure that the child receives adequate exposure to sunlight. It is important to remember that vitamin supplements does not prevent anyone from getting COVID-19. It may protect you from having complications. Social distancing, wearing face mask, hand washing, and other health practices such as avoiding crowded places are the only ways and means of protecting us from getting COVID infection. There's nothing else. Thank you.